Hello, friends. Namaste. I'm Himanshu Sharma from Zydus Hospitals, welcoming you to today's live session. Zydus Hospital continues its pursuit to bring you health issues that matter. And today's episode is dedicated to hyperthyroidism and radioactive iodine treatment. Today's session will address your concerns regarding some of the following points that I'm putting across: symptoms of hyperthyroidism, indications for reference, radioactive iodine therapy versus other treatment options available, therapeutic aspects of it, the process of administering the medication, the radioactive iodine therapy, side effects, and follow-up requirements. So these are some of the things and much more that we are going to touch on today. The reason why we chose this topic. Now, hyperthyroidism is made of two words, hyper and thyroid. Hyper, which means overactive, excessive. We all have used these words, right? Especially when we talk about our kids, hyper kid, or sometimes hyper boss, and often use it for our spouse as well. Well, so like us, the way we are hyper, even our glands are hyper. So we are going to understand how exactly the process proceeds when it comes to hyperthyroidism and how it affects our bodies. The second part is thyroid. I'm sure most of you know what thyroid is, but still, I'm going to just brief you on that. A butterfly-shaped gland located in our neck region. When this gland is overactive or secretes excessive hormones, the condition is medically termed as hyperthyroidism. And just like a notorious kid, this gland too can cause some trouble. And to address those troubles, we have our medical experts. Surprisingly, this medical condition may not have a very prominent symptoms in some or most of the cases. And that's why we have our expert panel of doctors today who's going to talk about hyperthyroidism and radioactive iodine therapy. I welcome our experts, Dr. Om Lakhani, who's endocrinologist and diabetologist at Zydus Hospitals in Ahmedabad, and Dr. Sunny Gandhi, who's a nuclear medicine specialist with Zydus Cancer Center. I welcome you both to today's session. Thank you very much for joining us. So we'll start, Dr. Lakhani, with you straight away. I would like you to highlight on some common symptoms of hyperthyroidism for our viewers. Just simplify it so everybody's able to connect it.
Okay, so thank you, and first of all, welcome to this event. Thank you, Himanshuji, for this event, and thank you for the question. So hyperthyroidism, the earliest symptom and the most prominent symptom is actually weight loss. And we always tell our patients very commonly that whenever you are experiencing any unintentional weight loss, so when by unintentional means that you're not trying to lose weight, but you're actually losing weight, that kind of condition should always be evaluated. And in such a condition, you should always talk to your physician or to your endocrinologist because you might be dealing with an endocrine condition. And in one of the important endocrine condition which you always consider is hyperthyroidism. So that's an important endocrine disorder you should consider whenever you have an unintentional weight loss. Apart from that, the characteristic feature of this weight loss is that these people tend to lose weight despite having an increased appetite. So they eat a lot of food, yet they continue to lose weight, which is a very interesting aspect of hyperthyroidism. A lot of people, if they lose appetite, they would lose weight. That's very natural. But in this situation, these people tend to have the appetite is pretty much robust, yet they continue to lose weight. Apart from that, there are other slightly more subtle signs and symptoms that you need to look for. These people often have tremors, right? So that's a very common thing. It's like a fine tremor. So you keep your hands stretched and you find that your hands are shaking. One of the important signs is your eyes. Often patients complain of the eyes bulging out. The eyes literally bulge out. The thyroid gland in the neck often enlarges in size. So you have a gland which is enlarged, which you might not be able to notice it, but someone in your family might see it and might bring it to your notice. So these are some of the common signs and symptoms of hyperthyroidism. For women, there might be, periods may be abnormal. So, there might be, the cycles may become longer. And, sometimes, these women are not able to conceive. So again, infertility also may be one of the features. And for elderly population, the symptoms are more subtle. So you might not have a characteristic signs and symptoms, but one of the clinical features is apart from weight loss also, which is common in elderly, they'll also have a little bit of loss of memory. They'll sometimes behave unusually. They might develop fractures. So all those things can also, be subtle signs and symptoms of hyperthyroidism.
Okay, thanks. So now we know at least the basic things about hyperthyroidism. So if you notice any of these symptoms, or any of your friends have similar symptoms, when you are too hungry, eating too much, and still losing weight, as Dr. Lakhani mentioned, please do visit a doctor just to rule out that you might be suffering from this disease. Another question to you again, Dr. Lakhani. Any indications as to when should a patient be opting for radioactive iodine therapy? Because obviously it's not something which is communicated very commonly to the patients. So it would really benefit if you can highlight those points.
Okay, so to answer that, I'll ask you to back up a little bit. So, just like hyperthyroidism is, there are, I think another term which is more appropriate to use for hyperthyroidism before we make a diagnosis is known as thyrotoxicosis. So, just like you said, hyper, we often call people toxic, right? So this guy is toxic, that guy is toxic, toxicosis means that, the gland is producing a lot of hormones, which actually is not supposed to do it. So, just like a toxic person is often very angry and he's not supposed to be. So that is thyrotoxicosis. Whenever you have a patient presenting with thyrotoxicosis, if you see the lab reports, the T3, T4 values, which a lot of people are now familiar with, because thyroid function are routinely done. So the T3, T4 values are on the higher side and the TSH value is on the lower side. So that's a typical thyrotoxicosis. Now, when a patient comes to me with thyrotoxicosis, the first thing I do is I send the patient to Sunny. And what Sunny does is he does a thyroid scan, right? Which is also a nuclear medicine procedure. So by doing the thyroid scan, we first establish the diagnosis of hyperthyroidism or the diagnosis of the thyrotoxicosis. So it could be that, your gland is producing a lot of hormones because the factory is, overactive. It is producing more, raw materials, and it is taking in more raw materials and giving out more output. So that condition, and which is typically a very typical form of hyperthyroidism, is known as Graves' disease. Sometimes you have a small nodule, which is, there's one part of it which is producing a lot of hormones. There could be multiple nodules which are producing a lot of hormones, or there could be something known as thyroiditis, where the thyroid gland is damaged and all the hormones are released into the circulation. So what Sunny does for me is he tells me what is the actual reason for hyperthyroidism. Now, if the reason for hyperthyroidism is the one which is the most common one, which is known as Graves' disease, not that it is very grave disease, but it is named after a guy called Grave. So it's known as Graves' disease. Probably the doctor who first identified it. So it's a Graves' disease, and Graves' disease is a condition where the thyroid gland produces thyroid hormone in excess. And in such a scenario, when you do a thyroid scan, you find an increased uptake of the raw materials in the thyroid gland. In such a scenario, we have three treatment options. So one is to give them medicines. Second is to do a nuclear medicine procedure, which is known as radioactive iodine therapy, which is our hot topic today. And the third is to perform a surgery. Now, these are the three options. So depending on the clinical and the medical condition, we give, sort of giving a menu to the, a person who walks into a restaurant. We give them all the three options, but we also tell them the pros and cons of each of them. And, if you see in the West, the option which is most often, chosen or most often preferred by patients and also by doctors is actually radioactive iodine therapy. Because radioactive iodine therapy, it is a simple procedure. It's not an invasive procedure. So it does not require any surgery. It does not require any kind of sort of surgical intervention. It's a bloodless, simple, very simple procedure, which Sunny will of course explain to you in more detail. It's a simple procedure. It can be done, in a day. It is completely safe, and it uses a new technology actually, that is radioactivity. It's like a Trojan horse. It's iodine which is bound to the radioactive material, which is taken up by the gland, and then it corrects the gland's hyperfunction. So that is what is typically done. So we generally choose radioactive iodine in almost all patients. That's often and sort of an advice we give them to consider radioactive iodine therapy, because it's a permanent form of therapy. You don't have to keep taking medicines for a long time. So that's one of the best options amongst these three is radioactive iodine. There are certain patients where we don't use it. If they're like I said, if their eyes are popping out a lot and there's a lot of inflammation in the eye, we often wait for that to subside before we consider radioactive iodine therapy. If that, thyroid gland is functioning so much that, if you, at that initial point of time, we need to give some medicines to control it before we send for radioactive iodine. Again, in such a scenario, we wait for a while. In pregnant women, obviously, you cannot use radioactive iodine. So these are the conditions where we generally, don't use radioactive iodine. But apart from these conditions, in most patients, radioactive iodine can be considered the first-line therapy, and it is considered as a first-line therapy in a lot of Western countries for hyperthyroidism or Graves' disease.
Thank you, Dr. Holmes. So now we know about what exactly is radioactive iodine therapy. We have some information. We'll go to Dr. Sani, who's going to give us more information, a little more in-depth information about what this procedure is all about. Dr. Sani, we would like to understand for how long has this procedure been there, for how long it has been used in the medical world, and a little more from your end about what exactly you perceive you would like to convey to the patients about this therapy.
So first of all, thanks Himanshu, and thanks Dr. Om for nicely putting up the indications. So that was very well explained. So this therapy has been given over 80, for last 80 years. The first therapy, radioactive iodine therapy for hyperfunctioning thyroid gland, was given in January 1940 in US. So for last 80 years, it has been in use. Apart from that, if you see in recent years, there was a survey conducted in US, in which what they wanted to see is what treatment option people are choosing for this particular disease condition. So what they found is around 60% of the patients of simple Graves' disease, hyperfunctioning thyroid gland, they opt for iodine therapy as first treatment option. So we have a good amount of experience for this therapy of around 80 years. So this is about it. And radioactive iodine is basically, as Dr. Om suggested, a simple form of treatment for hyperthyroidism, in which simple capsule or liquid is given, which is absorbed through intestine and it enters into the bloodstream. So after entering into bloodstream, it is taken up by the thyroid gland, which is highly active or toxic. So after entering into the thyroid gland, what it does is, because it is radioactive material, it gives radiation to thyroid cells. And because of that low level of radiation, it will cause destruction of the thyroid cells. So whatever cells were hyperactive, those get destroyed. So because of that, your hormone level also gets controlled, and ultimately, if gland is slightly larger in size, that size also comes down. So neck swelling sometimes patients have because of hyperfunctioning thyroid gland. That can also get very much controlled.
Okay. Thank you, Dr. Sani. So this is a therapy that's established. It's not experimental. It's not new. It has existed, and it has been successfully tested all around the world. Another question for you, Dr. Sani, now is, obviously it concerns all of us a lot. How about the safety and the administration procedure of this whole iodine therapy?
So obviously, if you hear the word radioactive and radiation, so a lot of people will have that fear psychosis kind of thing. So the first thing which comes to general public is cancer. Because of this treatment, will I get cancer? So actually, over last 80-year data in US and Europe and all over the world, not only US and Europe, we have enough data of 80 years, which was it is very little excess risk of cancer compared to general population. And if you see the advantages of this treatment, it is far more compared to very little excess risk of cancer. Another thing which comes to people's mind is, what about fertility? Does it cause any infertility? So that part is also very much clear. It doesn't cause any infertility. Actually, we advise a patient not to conceive for next 6 months. The only idea is because it can affect the development of the fetus. So after 6 months, patient can very well conceive. In fact, we have a lot of patients who have taken this treatment and then subsequently got pregnant and delivered normal baby. Not only that, but many times what we do is, if patient is having problem in conceiving, that just can be because of this Graves' disease. So what we do is we give radioactive iodine treatment, make them hypothyroid, complete after this completion of this treatment, wait for 6 months, and they can have normal maybe in future. Apart from that, there are concern of hair fall and all those things because of it, because of just word radiation, but it doesn't have such side effects. So it is very safe procedure, I must say.
Thank you. So all of you who had concerns about whether this is safe to administer or no, you have got your answer. It's absolutely safe. It may have minor side effects, which would go away. There is no effect at all on the fertility aspect whatsoever. And after 6 months, you can normally conceive. Thank you very much, Dr. Sunny. We are coming to Dr. Om again. Dr. Om, most of the patients would obviously go to their, close by doctors or a physician. I would like you to give some message or some indications to your doctor fraternity friends as well, those who will be seeing these patients as first line of interaction.
Okay, I think that's a very important question. First of all, I'd like to reiterate what Sunny just said. We have a lot of young women, and if you Graves' disease or hyperthyroidism is actually very common in young women. Right, this is a disease which is a common disease in young women. It's an autoimmune disease, so it tends to be more common in young women. Now, what happens is that a lot of the time, before marriage, or they just got married and recently, they are detected to have hyperthyroidism, or sometimes during they might not be conceiving, and during that fertility evaluation, somebody does the test and found they are found to have hyperthyroidism. Now, at this point of time, you have two options: either you give them medicines or you give them radioactive iodine, right? Now, and Sunny knows this, we are very strong proponents of the fact that, and this is what guidelines also, so international guidelines on, thyrotoxicosis and on Graves' disease actually recommend that such women should be actually, the preferred choice of therapy is actually radioactive iodine. The reason for this is that, if they are hyperthyroid and they are on medicines and they become pregnant, even accidentally, the problem is that those medicines which we give normally in hyperthyroidism, they are not safe in pregnancy. They can lead to side effects during pregnancy. So, and they can cause sort of, fetal malformations during pregnancy. So what happens is that if they become accidentally pregnant, we need to switch them over to another type of medicine which is safe in pregnancy. So that switchover process is not a very, convenient, it's not a simple switchover process. It's a slightly complicated one. So we switch them over to another medicine. The other medicine which we give, there is a small but a risk of liver damage. So what happens is that you switch to another medicine, again you are carrying a risk. Then after about the end of first trimester, we again go back to the original medicine because the second medicine which we give has long-term, or a potential complication. So it's like choosing between the devil and the deep blue sea, right? And when you're treating hyperthyroidism in pregnancy, so pregnant women with hyperthyroidism, it's a very, a challenging process for the doctor also, because then you have to, walk on a very tight rope. So, if you keep the hyperthyroidism on the higher side, again, the baby is likely to be affected. If you overtreat it and the, mother becomes hypothyroid, then again, the baby is affected. So again, you have, a very tight rope to deal with. So in such women, we always advise that, let's take a break. Let's give ourselves a 6-month or an 8-month window. First, we'll do a radioactive iodine therapy. Then that will cure your disease, right? It will give you a permanent cure. After that, we will correct. So hyper is converted to hypothyroidism. So we'll correct the hypothyroidism with a simple, those medicines like levothyroxine, pyranoromethoxine, very simple medicines, very easy to take, no side effects, nothing else, right? So we'll correct that. So we'll have that within the 6-month period, your thyroid function will become perfectly normal. Once your thyroid function becomes perfectly normal, after that you can conceive. And I'll tell you, a lot of women, we have a lot of women on our follow-up whom we have applied this strategy and they are doing very well. Their pregnancy has run completely smoothly without any problems. Their babies are also perfectly normal. There is no problem at all. And then they are permanently cured from a disease which could be potentially a problem. And remember, it's not a problem for one pregnancy. That problem remains. So unless you give a permanent treatment, the problem will again, sort of re-emerge during the next pregnancy, right? So again, you will, be dealing with the same problem again. So that is a challenge. So hence, the message to the doctor fraternity, to gynecologists, to physicians, who see such patients. If you have a young lady with hyperthyroidism, you should definitely offer them radioactive iodine therapy as the first line therapy, because it will give you a permanent cure. It will, and sort of a little bit of foreplanning, you will be able to, get a perfectly, a pregnancy where there is absolutely no problem. There is no side effects. There is no long-term complications. So, we can do that. And that's one of the important advice. And secondly, one other thing I've noticed amongst doctors is that sometimes, we ourselves are not too confident about a therapy, and hence we don't recommend it to the patients. But I'll tell you, like I said, Sunny also reiterated, radioactive iodine therapy is one of the older forms of, one of the oldest forms of therapy for, thyrotoxicosis. Of course, it is re-emerging now because of easy availability of the, of better availability of these, technology and materials. But it's well established. It's an old form of therapy. It's completely safe. And having said that, it is now easily available also. Previously, it used to be available only in limited centers in our country. Now it's easily available. It's available in Ahmedabad, at Zydus. It's available in other places as well. So since it is available, it is easily accessible. You have great specialists to deal with it. You have an entire field of medicine called nuclear medicine dealing with it. This therapy, I think we should also look at what standard practices are done in the West, and we should consider giving this as a first line therapy. And like you said, in the West, this is the first line therapy in most patients, unless there are certain other reasons why we don't. So I think that in this hyperthyroidism condition, I think for physicians, obstetricians, other people dealing with this condition, I think you should always give the option of radioactive iodine therapy to the patient, and a lot of patients would really benefit. And will actually, come back saying to you that their life has changed because, you have offered them a treatment which is permanent.
Thank you. So this has definitely given us an insight into what our doctor friends should be looking at, and also from the patient's perspective, what Dr. Om mentioned, that the planning is very important in this treatment. It's not just about popping in tablets and thinking that you are treated. It's something much more than that. Another small question, just an add-on to what you said, Dr. Om, right now. If I just request you to draw a small comparative between radioactive iodine therapy, the oral medication, and the surgery, how do we look at it from the medical aspect?
Okay, so let's first talk about oral medicines, right? Now, the medicines we give in this condition, they are generally come in a bottle. It's known as carbimazole. It's a standard medicine. It's not an expensive medicine, so very cheap, easily available. You'll find it everywhere. The problem is that you have to give the right dosing. So initially, you'll have to give a higher dose, then you have to taper down to a lower dose, and then eventually, to a very bare minimum dose. Sometimes, if you dose it, very aggressively, the person turns into hypothyroidism. So again, from hyper, you go to hypo. If you underdose it, if you don't give an adequate dose, the patient again remains hyperthyroid and remains to have the symptoms of hyperthyroidism. So, you have to dose it right. And dosing that is very difficult, as a lot of endocrinologists will also tell you. It's not as simple as giving a Thyronorm medicine or a Heltroxin medicine, which is straightforward. In this case, you need to have a significant amount of experience of how to titrate the dose. Secondly, you have to keep checking the thyroid function at a regular interval, right? So you need to keep checking it initially monthly, then 2 monthly, 3 monthly. So, you'd have to keep visiting me a lot of times, that's, and we'd love to see you, but, that's one of the challenges in COVID era also. The third problem is that, generally the duration of treatment with oral medicines is for 2 years. But at the end of 2 years, only 50% of the patients get a permanent cure. The other 50% continue to either require medicine, or at the end of 2 years, I'll have to send the patient to Sunny saying that now, boss, you need to do radioactive iodine, right? Because, there is no permanent cure in 50% of the patients with medicine. So that is the challenge with the use of oral medicines in hyperthyroidism. Now, if I had no other option for treatment, great, I'm okay with whatever I have. But since you have other options, that is what you should always consider. And you should always, I think you should offer to the patient. Ultimately, it's the patient's choice also to decide what to do. The other aspect is surgery. The thing with surgery is that we generally prefer surgery in patients who have a larger gland. So if the gland is very large, if it is compressing upon the, the food pipe, their windpipe, if it's causing, it doesn't look good, if it's causing cosmetic disconfiguration, those kind of things. In such scenario, we, send the patient over to surgeon Naturally, surgery is it's not a minor surgery. It's a neck surgery. It's a surgery, of course, carries its risk, but at the same time, done with the right hands, it's very safe. But having said that, again, surgery carries a hospital stay, more cost, so on and so forth. And again, surgery, you generally in these days we remove almost the entire gland. So because you remove the entire gland, again you will be hypothyroid for rest of your life. So I think in this scenario, radioactive radioactive sort of fits right. So my children listen to this story where you have this this girl who gets lost in the woods, and she goes to a bear's house, and you have a small bed, and you have a large bed, and there's a bed which fits just right. So I think radioactive iodine is something like that. It's not a small bed like that of a medicine. It's not like a large bed where you require admission in a hospital like a surgery. It sort of fits just right. So I think that is where I think, and in that sense, it's probably a perfect treatment. And in Indian patients, it's perfectly actually a very good form of treatment, because you don't if they're coming from far off places, it's you do the treatment. After initial follow up, you can then follow up with teleconsultation. It's very easy. But a hyperthyroid patient who is still on medicines, on carbimazole, I need to call them more frequently. I need to check their pulse. I need to check their blood pressure. I need to look at their eyes. Look at a lot of the other things, which we have to keep watching. To have to do an ECG all the time. So it requires more sort of intensive, more close care, and those things cannot be done on telemedicine. So I think it's much easier now to offer radioactive iodine and then follow up using telemedicine, especially for patients coming from more remote places.
Available to you, and take a conscious decision looking at a larger picture. So that's the whole idea about choosing the, as Dr. Lakhani very clearly mentioned, his example of 3 beds is going to be very easy for all of us to remember. So the right sized bed is radioactive iodine therapy, right? So please do remember that. As we come to the last section of the session, a few questions to Dr. Sunny as well. So Dr. Sunny, obviously we have understood and learned a lot about what exactly is hyperthyroidism, what are the different symptoms it can present. Now about the treatment part of it. How long does the treatment, in case somebody opts to come to you at Zydus, how long would the treatment be? How many visits would a typical patient require, assuming they are not from Ahmedabad, they are traveling for specifically this purpose? If you can just answer.
So first of all, this therapy doesn't require any admission. It is OPD based procedure only. So that is important message. Then next thing is, before going for this therapy, patient need to stop their anti-thyroid medicine for 3 to 5 days. And apart from that, just 3 hours has to be required. So after following these things, patient can come to department. And in department, what we do is we give radioactive iodine. It is available in the form of capsule or liquid. That has to be taken orally along with simple sip of water also. And we allow them to we tell them to stay in the hospital for department for 2 hours or so, just for observation. Most of the patient doesn't develop any problem with this therapy, but just for observation, we are keeping them for 2 hours. After that, we can allow them to go to home with a certain precaution they have to take, such as for radiation safety purpose, basically, so that they have to keep themselves away from pregnant ladies, small children, because all those people can have a higher risk of radiation. Apart from that, in this COVID era, everybody knows about physical distancing thing, so it will be easy for me to explain those aspects as well. We have to follow certain physical distance, especially for 7 to 10 days. That's it. Nothing significant. I mean, this therapy doesn't have any. After injection, it doesn't cause any warm feeling or taste or nothing. It is very simple thing. And after giving this therapy, complete effect will occur within 1 to 3 months, because it delivers radiation every day for around approximately 3 days or 3 months or so. So complete picture we can assess after 3 months. And what is the desired effect? That is making patient hypothyroid from hyperthyroid. So basically, we want to make patient's thyroid gland hypofunctioning from the level of hyperfunctioning. So obviously, we have to call them for the follow-up, because anytime between 1 to 3 months, they may turn into hypothyroid. So at that point of time, we need to give them thyroid supplementation. So for that, we have to call them. So first follow-up would be around 6 weeks or so. And again, second follow-up we can call after 3 months of therapy. So that is for two purposes. One is to see whether hypothyroid has set in or not. And if it has already developed, then we need to start the therapy of supplementation of the thyroid hormone. And we need to titrate the dose of the thyroid hormone, because again, it should not be overshooting the normal desired level, or it should not be undertreated. So that is one thing. And third thing, what is required is in follow-up basically is to see whether this treatment has served its purpose or not. If patient is still hyperthyroid, we need to wait for 6 months. So at 6 months down the line, patient is still hyperthyroid, then we may consider for second dose of radioactive iodine. So that is how the follow-up schedule is.
Any long-term side effects of the therapy?
So the only side effect, basically it is not side effect, it is the goal of the therapy to make patient hypothyroid from the level of hyperthyroid. So basically we are giving sufficiently high dose to make patient hypothyroid. So once patient is hypothyroid, we can put them on thyroid supplementation. So that is the only major side effect. Apart from that, patient can develop problems like thyrotoxic crisis. That means whatever thyroid hormone is within the gland, that can get released into circulation, and patient can have problems. Apart from that, the patient can have, if patient is having eye problem because of hyperthyroidism, it can get worsened. But these two problems particularly doesn't develop in routine clinical scenario, because we take enough precaution before giving this therapy. So in a routine clinical scenario, we don't see this worsening of eye symptoms or thyrotoxic crisis. This scenario is not really common. So this we take care of before administering the radioactive iodine therapy. Sometimes some patient may have some pain in the neck for few days. So that can be tackled with a simple anti-inflammatory agents. So nothing more side effect, and nothing much significant side effect with this therapy. So it is absolutely safe.
So friends, if you are suffering from this disease, from this disorder, and you do not want to keep visiting your doctor again and again, possibly in 3 to 4 visits, you will be sorted if you opt for radioactive iodine therapy. With this, we have drawn to the end of the session. Please do share your feedback with us. If you have questions or concerns, please
So I think there's some technical issue. So yeah, I'll just summarize what we discussed today. I think radioactive iodine hyperthyroidism is a not an uncommon endocrine disorder. Where you often have initially a lot of weight loss, tremors in your hands. You might have an enlarged gland. Your eyes may pop out. These are symptoms of hyperthyroidism. When you have hyperthyroidism, you have three treatment options. You have medical therapy, you have surgical therapy, and what we discussed today was radioactive iodine therapy. And radioactive iodine therapy is a permanent form of therapy for hyperthyroidism, which can easily be administered in a day without any hospital admission, without any any complicated procedure. It of course requires a follow-up for a few months, but once your thyroid levels are stable, after that for most of your life you are generally fine and does not lead to any further issues. So I think Sunny, anything you want to add for that?
No, I think so. It is the problem until now was availability was the major issue.
Yeah.
It has not been so popular in our part of the world. Otherwise, it is a proven therapy, and definitely people can, patient can opt for this therapy because it is the permanent solution for hyperthyroidism.
Yes. So it's a permanent form of therapy now easily available in Ahmedabad, at Zydus Hospital. And, if you have any questions and concerns, you can follow us on the Facebook page, on the Twitter handle, and on Instagram. Dr. Sunny is available at Zydus Cancer Center. I'm available at Zydus main building, Zydus Hospital main building, and you can visit us for any questions, queries, or consultation. So I think we can end here, and I think again we thank Zydus Hospital for giving this a platform to us to share our views, and of course your questions would be we'd love to take your questions and queries. If they do come about, even after the session, you can send them over, and we'll try to answer as many as possible on our social media handles. So I think we can end here.
Yes, I think so. Thanks.